Welcome back, everyone, to the deep dive. We've got a lot of requests to take on this topic.
Yeah, vaginal bleeding in infants and children.
So we're diving into the Merck manual to see what's up.
Good plan. Lots to consider with this
I
one.
know, right? I mean, just flipping through, it's like, whoa, okay, there's a lot more here than I thought.
For sure. Definitely a topic that needs, well, a deep dive, especially when
Yeah.
you think about how the causes can be so different depending on how old the kid is.
Right, right. Okay, so let's start with the little ones, the newborns.
Okay.
So I read that sometimes newborn baby girls can have a bit of vaginal bleeding,
Mm-hmm.
which sounds kind of freaky, but the Merck manual says that's sometimes normal.
Yeah, it can be. It's actually all about the mom's hormones. You know, before birth, the baby's exposed to all these high levels of estrogen,
Ah.
specifically estradiol
Mhm.
from the mom. Then after birth, that estrogen, boom, it plummets.
I see.
And it's that sudden drop that can cause a little bleeding
Interesting.
in the first week or two. Think of it like a mini period. The baby's body is just like adjusting.
So like a teeny tiny withdrawal?
Exactly.
That's wild.
Yeah.
But even though it can be normal, I bet parents should still mention it to the pediatrician just in case.
Oh, 100%. Always better to be safe than sorry.
For sure.
But then when we move past those first few weeks, any bleeding after that, well, that's considered abnormal
Right.
and needs to be checked out. And here's where things get really interesting because the potential causes, they really branch out.
Yeah, the Merck manual mentions everything. I mean, like a foreign object, like a little kid putting something where it shouldn't be,
Yeah.
all the way to infections and even hormone stuff.
Yep. Got to think about the whole spectrum. Right.
Totally.
So yeah, toddlers, we know they put things in their mouths, their noses. Well, it's not that unusual for small things to end up in the vagina too.
Makes sense.
And then infections. Well, as kids get moving around more, exploring, infections are always a possibility.
Yeah, okay. That stuff makes sense. You can kind of imagine that happening.
Yeah.
But then there are things like, and I'm reading this straight from the Merck manual, prolapse of the urethra. What? It just sounds scary.
It does sound scary.
I had no idea what that even was until I was reading up for this deep dive.
Let's break it down. Basically, it means a small part of the urethra, the tube that carries pee,
Yeah.
it sticks out a little bit. And it's more common in younger girls, especially before puberty, because their pelvic floor muscles are still developing.
So weaker muscles, basically.
Exactly.
So does that mean, like, it can just go away on its own? Or does it need a doctor?
Definitely needs to be checked out by a doctor. It might not seem like a huge deal at first,
Okay.
but if it's not taken care of, it can lead to, like, recurring UTIs.
Well, no fun.
And even more problems later on.
So weak pelvic muscles are part of the problem. Is there anything else that makes it worse?
Yeah, chronic constipation. If a kid's straining a lot during bowel movements, that can make things worse. So making sure they're, going to the bathroom regularly and all that, that's actually important here too.
Wow, that's a connection I would not have made.
It's all connected.
Okay, now, the Merck manual, they have this crazy table. It's got like all these causes of vaginal bleeding, the symptoms, how to diagnose it.
Oh, yeah.
I feel like we could spend the whole deep dive just on this table.
It is a great resource. And it shows just how many different things can cause this.
Right.
We can't go line by line, but there are a few things worth talking about. It mentions precocious puberty, for example.
Yeah, precocious puberty, I gotta admit, I don't really get that.
Yeah.
It's like puberty too early or something.
Exactly. Precocious puberty means a girl starts showing signs of puberty before age 8.
8.
Yeah, like breast development, pubic hair, maybe even a period.
Wow, okay.
So if a parent sees any of that before 8, call the doctor.
Makes sense.
Definitely needs to be checked out to figure out what's going on.
So that's a hard and fast rule. Before 8, doctor. Okay, good to know. And speaking of the doctor, taking your kid to the doctor, especially for something like this, yikes.
I know it can be a little stressful for everyone,
Big time.
but the important thing is to talk to your kid. Explain what's going to happen
Yeah.
in a way they can understand. And it can really help to find a doctor who, specializes in kids
Oh, so someone who really gets it.
or in adolescent gynecology. That way it's going to be a good experience.
So it's all about finding that doctor who you can trust and who makes your kid comfortable.
Yeah, exactly. Remember, you're there for your kid.
Right.
Don't be afraid to ask questions. Speak up if you're worried about something.
For sure.
Make sure your child feels heard.
So it's not just about treating, like, the bleeding or whatever.
Yeah.
It's about making sure your kid is okay, like emotionally, too. It's a whole thing.
Absolutely, 100%. It really is. about taking care of the whole child, both the physical and emotional stuff.
Right, absolutely. So, okay, as we're going through this Merck manual, one thing that stood out to me was this section on like evaluating the bleeding. There are some things like red flags, that need a doctor like right away.
Oh, yeah, for sure. So any vaginal bleeding in a child, we're saying call the doctor, but
Yeah.
there's some things that are more urgent.
Okay. Yeah, like what?
So let's say the child is, I don't know, loses consciousness or seems really weak, lightheaded, or their skin's cold and sweaty. That could be shock, and that's a big deal.
Yeah, that sounds serious.
Definitely needs immediate attention. Same thing if they're having trouble breathing or their pulse is weak and fast. Don't mess around with that.
Got it.
It's not just internal stuff, though. If a child is having trouble walking or sitting, or if there are bruises or tears around, the genitals or anus or any unusual discharge redness, those could be signs of some kind of trauma. And sadly, sometimes that could mean sexual abuse.
Oh, wow. Yeah, I mean, that's a really tough situation.
It is. It's really sensitive and complex. I think the main thing is to just stay calm and supportive when talking about this. And if a parent has any concerns, any at all, they should talk to a doctor right away.
Absolutely. Better safe than sorry.
100%.
Okay, so shifting gears a bit, what actually happens at the doctor's appointment for vaginal bleeding? Like, what will the doctor ask? What kinds of exams are done?
Okay, so first, the doctor will take a really detailed history. They'll want to know all about the symptoms, when they started, how often they happen, stuff like that. They'll also ask about any other health issues the child has, medications, allergies, family history, all that.
So it's pretty thorough.
Oh, yeah, they really cover everything. And with babies, they might also ask about the pregnancy, the delivery, if there are any problems.
Makes sense. So after all that, then what?
Then they'll do a physical exam.
Which is,
Usually they'll start by checking the vital signs, temperature, heart rate, blood pressure. Then they'll probably feel the abdomen, just checking for any tenderness or anything unusual. And then depending on the age and the symptoms, they might do a gentle exam of the, genital area.
just externally.
Yeah. Yeah, usually just external. A more, internal pelvic exam that's usually only done if it's absolutely necessary.
Okay. I was going to say, that sounds kind of intense for a little kid.
Right, and that's why if they do need to do that, it's usually done under sedation or anesthesia.
Oh, okay. That makes sense. So the kid's comfortable.
Exactly. Comfort is key. Now, besides the physical exam, they might also do some tests.
Oh, yeah? What kind of tests?
Depends. Depends on how old the child is, what the symptoms are, and what the doctor thinks might be going on. A common one is a complete blood count that can check for anemia or if there's an infection.
Mm-hmm.
They'll often do a urinalysis, too, to rule out a UTI. And sometimes they might take a vaginal swab to test for infections or other things.
So they have a lot of tools to figure out what's happening.
Yep, they do. It's a process, but they'll get to the bottom of it. And remember, the doctor is there to help you through this. To answer your questions, ease your worries.
That's good to hear, because this is a scary topic for sure.
It can be, definitely.
We've been talking a lot about, like, the medical stuff, but I think it's also super important to remember that this can be really tough emotionally for both the child and the whole family.
Yeah, 100%. A child who is experiencing vaginal bleeding, they might be scared,
For sure.
confused, maybe even ashamed. It's so important to make sure they feel safe,
Right?
supported, and let them know it's okay to talk about how they feel, ask questions.
Yeah, even if they're really little and can't really say what's up,
Exactly. They can still feel that you're there for them.
just that you get it.
Yeah, that's the most important thing. And you can always ask the doctor for advice too.
That makes sense.
They can explain things in a way that's right for the child's age. They might also know about support groups or other resources. And it can really help to connect with other families who've gone through the same thing. There are online groups, in-person groups.
That's a good point. So it's not just you. There's a whole community out there.
Exactly. And parents, take care of yourselves too.
Yeah, it's a good reminder.
It's a lot to handle. It's okay to feel overwhelmed. Don't be afraid to ask for help if you need it.
For sure. We all need help sometimes.
Absolutely.
Speaking of difficult conversations, I think we should talk about something that's really hard for parents to even think about. The possibility of sexual abuse.
It's a tough topic, but it's important to talk about it. When we're talking about vaginal bleeding in children, we have to be aware of the possibility of abuse.
Yeah, okay. So what should parents be looking for? Like, are there any warning signs?
One of the biggest signs is changes in behavior. Like if a child who is outgoing suddenly becomes withdrawn or they get anxious or aggressive, clingy, Those could be signs that something's wrong.
Okay, what else?
Nightmares or trouble sleeping, bedwetting or accidents, even though they were potty trained, or if they start talking about sexual stuff, things that are, not appropriate for their age.
Yeah, okay, I see. Those are all things to keep an eye on. But what if a child doesn't actually say that they've been abused?
That's tough. It's why it's so important to really pay attention to any changes in your child's behavior. And if you have any suspicions at all, even if it's just a gut feeling, you need to get help.
What kind of help? Who do you call?
You can call your child's doctor, a child protection agency, a sexual assault hotline.
Okay.
Those organizations have people who are trained to help you.
It's hard to even think about. But I'm glad we're talking about it because it's real.
It is. And the more we talk about it, the better we can protect kids.
Okay, so we've covered a lot in this deep dive. Causes of bleeding, going to the doctor, treatments, emotional stuff, even that really tough topic of sexual abuse. As we wrap up this part of the deep dive, what are your final thoughts for our listeners?
I think just remembering that, knowledge is power.
Right.
The more we know about this, about vaginal bleeding in children, the better we can take care of them.
Absolutely. That's
Yeah.
the whole point of this deep dive, right? Giving parents the information they need.
Exactly. And remember, you can always ask questions, get a second opinion if you need to,
Yeah.
trust your gut. You know your kid best.
And don't be afraid to reach out for help. We've said it a bunch of times, but it's important. We've been focusing on the Merck manual, which has been really helpful, but there are other ways to think about this too. Some parents might want to look into other kinds of therapies, like alongside conventional treatments.
Yeah, that makes sense. Taking a holistic approach to healthcare can be really valuable.
Yeah.
And it's so important for parents to feel like they have a say in their child's treatment plan, working with their healthcare providers, of course.
Right, like a team.
Yeah.
Finding the best way forward for each kid.
Exactly. There's no one right answer for everyone.
Especially with something like this. And I imagine that different cultures, different families, they might have different ways of thinking about all this too.
Oh, yeah, for sure. It's so important to be respectful of those differences, to be sensitive, Having a doctor who understands those different perspectives, that can make a huge difference.
Absolutely. Okay, so before we wrap up this deep dive, I want to go back to something we talked about before. Preventing this from happening in the first place.
Okay.
Is there anything parents can do to lower the risk of their kid having vaginal bleeding? I mean, I know we can't prevent everything, but
Yeah.
Are there things that help?
Definitely. One of the best things is teaching good hygiene. Simple things like wiping the right way after going to the bathroom,
Right?
washing hands a lot, baths or showers regularly.
Stuff we should all be doing anyway. Right.
Exactly, but it's extra important to prevent infections, especially, in those sensitive areas.
Makes sense. Anything else?
Yeah, encourage your kids to wear cotton underwear, the kind that breathes. And avoid clothes that are too tight, that can trap moisture, and, well, that's how bacteria grow.
Oh, wow, the clothes thing. I wouldn't have thought about that.
It's easy to forget about those little things, but they can really make a difference. And of course, those regular checkups with the pediatrician, those are super important. The doctor can keep an eye on how your child is growing and developing, make sure everything's on track.
Those well-child visits are so important. It's not just about getting shots and measured. It's about having that relationship with your doctor, feeling comfortable asking questions.
Exactly. It's a partnership, working together to make sure your child is healthy.
Well said. And before we sign off, I just want to say that we love hearing from you all. So if you have ideas for future deep dives, send them our way.
Yeah, we want to know what you're interested in.
All right, so as we wrap up this deep dive on vaginal bleeding in infants and children, I just want to leave everyone with this. Let's keep talking about these important issues. Let's get rid of the stigma around kids' health. And let's make sure all children feel safe, supported, and ready to thrive.
That's what it's all about. Knowledge is power. And together, we can make a difference.
Thank you for joining us on the deep dive. Until next time, keep learning and stay curious.